I explain, it took me a while, like you said, it took me a while to be comfortable saying that I had the surgery.
Right.
Because I'll be honest, you feel like a failure. And I don't know if you find that from other patients, but I, at the end, was like, what is wrong with me? Why can't I do this on my own? But I think it was a bigger step to say, no,
Right.
I do need the help.
Absolutely. It wasn't your fault. It's not, there's so many factors genetically, your predisposition for that, your lifestyle. That's another thing. And the population group.
Yeah.
Everything, to be honest with you, everything is surrounded by food.
Welcome, everyone, to the second episode of Seasons. I'm so excited today because this is someone who is very close to my heart, who has literally changed my life. And on this podcast, we talk about the good, the bad, the beautiful. And I'm so excited to introduce Dr. Michael Choi of bariatrics. He's going to go through with us everything to do with bariatrics, how he literally changed my life, what the process was, and everything else to do with weight loss.
Well,
welcome.
Thank you so much, Miss Daniela. You were, not just because I'm saying this, you were an excellent patient. You followed all the rules and you reaped the rewards.
Thank you. A little bit about me, who those don't know. I had two beautiful children and gained 100 pounds. Yeah. And, not atypical for a lot of women. But it was really, really hard for me. I had postpartum with my first child. And even before, lifetimes before, talking about the seasons of my life, I've always struggled with food. Obviously, that's how you get that big. But it was rough. It was rough, taking care of a kid, taking care of myself, late night eating. The kids are up at 4 a.m.
Yeah.
You grab a snack, and the cycle just goes.
Yep.
And after years and years, in my second child, I decided to find you, and I was blessed.
Yep. Well, it's, as you said, it's very, very stressful being a parent. You're expending a lot of energy. You're not eating correctly at those certain times that you need to. And then once you finally get home and then you put your kids and you haven't eaten yet, then you eat after. Right. And then what happens after you eat? What's the first thing you want to do? You just want to lay down to the bed, watch a little TV, and maybe spend some time with your hubby. But then it all comes back again. It all
comes back, yeah.
And then what is it? Really, there's one more thing that's really important, Ms. Daniela, the lack of sleep.
Yes.
The
completely.
Lack of sleep, what happens is then your body compensates and wants you to eat more.
Exactly.
And it's not because you're just trying to survive.
Absolutely. I couldn't have said it better. Literally trying to survive.
Yeah.
And I know countless women, some say you bounce back, and some say, just, watch what you eat, or breastfeeding. I find that to be a misconception, because I know women who have breastfed and they didn't lose all their weight. Like that was something, you're going to lose all your weight from breastfeeding. And unfortunately, I wasn't able to breastfeed. Right. I just didn't develop milk. So that was out of the question for me. So it's like, okay, all of these things that I was banking on
didn't work out,
didn't come to fruition.
Yep.
I worked out as much as I could. But like you said, the lack of sleep.
Yes.
Especially for someone who finds comfort in eating.
Yes.
It's a struggle.
Yes.
It's a struggle. And it doesn't matter if you try to eat healthy and you try to eat the right things. It's exactly what you said. The timing, your body never has time to
rest.
Absolutely. Yes. Digest.
Yes.
And I honestly, for me, felt like my body was holding on, kind of like a fight or flight response.
Absolutely.
Like it just wouldn't go. It didn't matter what I did.
Right. because everything that you ate and then the energy that you put into, you were just burning the calories that you were eating.
Right.
Right?
Right.
And so it would start the next day, you would do it.
Yes.
So it would be like an endless Ferris wheel that you were doing that.
Absolutely.
Okay? And then I can't tell you, I know this, you have to have at least 8 hours of sleep. Right? And it's proven. Why do I say that? Because I have patients that work the night shift.
Yes.
And then there are patients that don't work the night shift. The patients that worked the night shift had a slower weight loss.
Yeah, I can imagine.
Versus the patient that, because the body is not used to it, and what they do, the first thing that they would do when they got back home was eat a meal.
Right.
Right?
Right.
I had to tell them not to eat that meal and maybe take a protein shake and go to bed.
Yes.
So that things were good.
Yep.
So they could lose weight. But exactly as you said, if you don't get 8 hours of sleep, irregardless if you have weight loss surgery or not, you will not be successful in weight loss.
Absolutely. Late night eating.
Oh,
That's
yeah.
the worst.
Everybody. That's the norm.
That's the norm. But when you're up at 2 a.m., 4 a.m.,
Yes.
so you're just constantly eating
Yes.
or trying to, soothe yourself in some way.
Absolutely.
For someone who had, a binge eating disorder, it's just,
Sure.
you're soothing yourself. You're feeding your kid. You're feeding you. You're feeding everyone else. There's
except for
always
you-
food.
Except for you.
Except for me. Yeah. But, and it's funny because I went through in my mind, like, what is it? I really don't eat that much. But, if you don't count the calories, it's the type of food you're eating.
Correct.
Which, goes to even after surgery.
Yes.
Maybe you're not eating that much, but what is it that you're eating?
You're absolutely correct on that also, Daniela. We as Americans eat a lot of processed foods.
Yeah.
Like we eat like hot dogs. We eat, ham. We eat all this packaging stuff. We eat all the frozen stuff, which isn't really good for you.
No. And it's easy. Everything is comfort. Everything's easy. McDonald's, 2 seconds.
Well,
I mean, you find a cheeseburger for $2 versus a salad for $7. What are people
Absolutely.
reaching towards?
but I only expect you to make a beef Wellington for me and have a turkey cooked for me with all the trimmings and stuff like that. But as you said, it's convenience.
Yes. Yes.
Fast food is probably the most convenient, but the worst food for you to have.
I know. And it's hard to break that cycle, even with the kids. Like we try to be conscious and, even though they see it and they're like, oh, I want to go to Burger King.
Yes.
Like maybe once a month,
Yes.
let's try to limit it.
Absolutely.
I don't like to say no because prohibiting, that's another cycle you get into when you restrict yourself.
Yes.
That's the worst.
Yeah.
But there has to be balance.
Yes.
And it's very hard to find.
It's very, very difficult because then when your kid goes to the kindergarten, they're
Right.
like, "Mommy, look, they got that Happy Meal thing, and can we get that?" And you're like, "Well, it's really not good for you, son."
Right.
But what am I going to do? Not let you have it?
Yeah.
But that's where, by convenience, like this whole world needs balance, as you said. We need to eat more vegetables, less cake, less sugar. But it's hard. But hopefully
really
things will
hard.
change.
Yeah. But it is really all internal.
Yes.
It's what you put in.
Yes.
It's your skin. It's your hair, your weight.
Yes.
But I'm really noticing that on a personal level, like it really shows what you're putting in your body and
absolutely.
the nutrients. If you really switch the focus of eating for nutrients versus pleasure or a treat, because a lot of us treat ourselves. And then you
Yes.
get into that cycle of, well, I'm just gonna have a treat, or I deserve that. There was a lot of that. I deserve that.
Yes.
And that, that facilitates the cycle.
No, you're absolutely correct, because some people just rather eat to feel full, to reach satiety,
Right.
instead of eating correctly. But also on a counterpart, if you want to eat well, Daniela, it's
Right.
more expensive.
Yes, exactly.
Right?
It's
So-
really expensive.
so-
Whole Foods, Sprouts, like all the good places.
So the Whole Foods, the joke is whole check.
Correct.
Because you can't
the
get
truth.
$100 is not going to get you anything if you want to eat healthy.
I know.
But $100 at Burger King, McDonald's,
Exactly.
will feed you for the whole
For the whole month?
family.
Yes.
Taco Bell will feed you for the whole
Yes,
family
yes.
that night and the next 2 nights.
Yeah. And like I laugh about it, but it's also really sad. And that's how we got into this
Yes.
obesity epidemic. You see it
Yes.
on Netflix, you see it everywhere. It's not a
Yes.
secret.
No.
You see other countries who eat, I was just seeing like it was in Asia. How
Yes.
come they get to eat rice and they, don't get heavy?
Yes.
But it's what you said. It's how we process it. Where are we getting it from? How much are we eating?
Right.
Finding the balance.
Right.
We don't have that. We're not taught that.
Plus, Europeans in Italy, Greece, China, or Asians, they walk more.
That's the truth.
Right?
Yes.
They walk. We're by convenience. We'll take an Uber. We'll take the Tesla Uber. We'll
Good
do
point.
something. But you see in the Netherlands, they ride bikes.
Yes.
Okay.
That's true.
The Italians, they walk everywhere. And believe it or not, they do worse things. They drink and they smoke, and
Yes.
they still healthier than us.
Pizza, pasta, the whole
Yes.
thing. But you're right. The expenditure.
And it's not processed. All the
Right.
bread and stuff, they don't have any
Yes.
contaminants. They don't have anything. It's all pure because that bread doesn't last. After one day, it's
Yeah.
hard as a rock.
Yeah.
But if you buy bread here, it'll last for weeks. And you're like,
Yes, it's so true. I've noticed that. And
Yeah.
even reading some of on like a fresh loaf of bread from Publix, for example.
Yes.
I read all the additives and I'm
Yes.
like, why are there so many additives in a loaf of bread?
To keep it longer.
Correct. But then
Yes.
what's that doing to us?
Oh, who knows?
Exactly.
Yeah.
I want to get into you and how you got into bariatrics.
Okay.
I want to say, because we're going to talk about it, I have tried all the options before coming to you.
Sure.
I did Weight Watchers and I was very successful before kids, but the mental
Yeah.
kind of never came back afterwards.
Yeah, I don't think that it works for a time being, but I don't think human beings like to be limited.
That is a huge point. And same back to what we just said.
Yeah.
I know stories of parents who limit their kids and then they
Yes.
go secret eating at their friend's house.
Absolutely. Absolutely.
I mean, I've seen it all, and that's what happens. It's shouldn't have that, don't have that, but it's about teaching them correctly. You can have that. Eat your fruits and veggies.
Right.
Let's be healthy. Protein first,
Yes.
which we all try to do. But
Yeah.
my kids, luckily, I offer to them all the time. Do you want dessert? Do you want anything? And a lot of times it's no.
Good.
Yes. And I'm like, great. Okay. You want a
don't-
fruit?
Yeah, you don't need it. Yeah, have a piece of fruit, but it doesn't work that way. Everyone wants to have, we have so many TV food
I know
food
that
stuff.
too. Yes.
And then you're like, oh my God, that looks so good.
Right.
Even I say that.
Yes.
And I'm like, no, I can't have it. So,
Right.
But it's all, as you said, balance.
It's really balanced. And it was really hard for me because as a person who, again, went to everything for food, it became a punishment.
Sure.
And I really had to reframe going to the gym as loving myself.
Yes.
Eating to fuel myself and give myself the nutrients.
Absolutely.
And that is a form of self-love that sometimes you lose when
Right.
you're that overweight.
Exactly. Exactly. Your perception of yourself has changed.
Yes.
And I can see that from the beginning through your process, because you were a little bit more hesitant in the first, and then you kind of opened up a little bit more as the weight loss started to progress even more and more. And now you're here.
Yes. And something that I say, a quote that I've a mantra that I've started to really try
Sure.
to take on is, it's not changing who you are, but finding yourself again.
Yes.
And I think, talking about the seasons of my life, that's what it was about. I just wanted to feel like Daniela again.
Yes.
Like, where was I? As a mother, as a wife. As soon as my son was born, my husband and I started a business.
Yes.
So then I was a business owner.
Yes.
And everything at the same time, there was very little room left to take care of me.
Of course.
And then that just years
Went out-
passed and the years
went out of
passed.
control, yeah.
Yes. And then the depression and the anxiety. But it's all embedded, when you don't know yourself, when you don't love yourself, that only creeps up more.
Right.
And then you're back in this cycle.
Right.
And so I really did try everything in my power. Of course, people can say you could have done this and you could have done that. And there's, a million different influencers, and try this diet and do this diet. And it doesn't work like that.
Yeah.
It's just,
Because everything is individualized,
Yes.
Daniela. So what might work for you might not work for somebody else. And I wish I could say that, all my patients, they are successful,
Yes.
but they're not as successful as other people, because one person might lose 10 to 20 pounds like that. And some people, I call them slow losers. So
Yes.
they go months and months and
Yes.
months, and they'll
And
only
it's
lose 10.
discouraging.
It is discouraging. They're like, oh, did you do something wrong?
Oh,
Or
gosh.
did I do something? I said, no. It just means that each person is different. So
Right.
as you said correctly, just, I know there's people who do really well on weight loss injections. And then there's some people that are like, months and months, I've had no results.
Yeah.
So you need to find that individualized treatment that you like, that you feel comfortable with, and that there are options. Now, as you come and meet a doctor, not only me or any other bariatric surgeon, he will give you the right answers, meaning
Absolutely.
that if you want to try the balloon, if you want to try the gastric bypass, if you want to try the sleeve, or if you need a revisional surgery,
Yes.
then I take your band out and convert you into sleeve or to a bypass. It doesn't mean, or some people just like, you know what, Dr. Choi, I just want to try the injections. I said, not a problem.
Right.
We can start you on a low dose and see how it goes, and we'll slowly increase your dosage
Right.
after you're successful. And then
Yeah.
you're like, some people like, I had enough. I really don't want. I now understand what's happening.
Yes.
And I don't want to be on it
Yes.
anymore.
And that happened to me. It only came out a few years ago.
Absolutely.
I mean, I'm sure you can tell us, how long it's been on the market.
Right.
But for me, it was introduced, I don't know, maybe 2 years ago, and it was like the thing.
Yes.
But it was very hard to get at that point.
Yes.
And you had to go in. I remember traveling, and I had to go in to get the injections. And then they
Yes.
had to order it, and it took 3 weeks. And it was very expensive.
Yes.
And then Ozempic didn't work.
Right.
Oh, I'm going to switch you to trizepatides.
Mounjaro. Yes.
Tried that too. Wasn't feeling so great. Had hair loss.
Yes.
I mean, and then I'm like, something that you and I have talked about off camera. Do you want to be on a shot for the rest of your life?
That's right.
And, I was already thinking about how could I be more healthy?
Yep.
And to me, to be honest, and I want you to talk about, bariatric surgery, I felt like that was the cleanest thing that I could do.
Sure.
Because it was, yes, altering myself. And a lot of people are worried about anesthesia and surgery and why would you have surgery? But I understood that if I could change myself again internally, that's where I would find the results.
You're bringing up a great point. And what I think people don't understand due to the lack of education is that you had a gastric sleeve. Okay. So what does that mean? That means that I need to cut out 70 to 80% of your stomach, right? But what people, and maybe some people don't understand, that piece of stomach, the greater part, has this hormone called ghrelin inside. Okay, so ghrelin and leptin are these circadian hormones that go up and down. Mm-hmm. If you take one out, then there's no rhythm anymore.
Right.
So as you know, I know you've experienced, you might not feel hunger as much. Mm-hmm. Some people tell me they are not hungry anymore and they don't look for food. But that is one of the big premises that I try to stress with gastric sleeve.
Yes.
I think I think gastric sleeve is better than a bypass. This is just my opinion.
Yes.
Why? Because if you have a problem with a gastric bypass, there is no revisions.
Right.
You're permanent, because we've been starting to see a lot of patients that are gaining weight after a failed gastric bypass. The only other things that you can do is probably reverse it, which is a really complicated surgery. Not saying that we want to do it, but the risk versus reward, in my opinion, as a bariatric surgeon, is not that great. But if that's the only option, then you have that. But with the sleeve, you can transfer, you can revise that to a gastric bypass, or something called a SADS, or a modified duodenal switch. Those are things. So people who have had a fill sleeve, they have other options.
Right.
So that's why I like to give my patients that option first, because you'll have other options in the future. But if you confine yourself or limit yourself just for the bypass, then there's not, and if it fails, then there's not much you can do with that.
Yeah. I want to go into a little bit about how you got into bariatrics.
Sure.
Was it a choice? Did you have someone that was overweight, or was just practice that you went into?
No, it's a very funny story. As I said, so after completing my general surgery in New York, what happened is that laparoscopic surgery was on the cusp. It was pretty interested, but I didn't feel like I was a good laparoscopic surgeon.
What is that?
So laparoscopic surgery is when you make 4 little incisions, and instead of conventionally cutting someone open up and down, so then you look at a camera and you operate the instruments outside, and that's how you operate. And that's the future back then in 20 years ago. So I felt, okay, I know a little bit, but I'm not too sure about it. So I was very fortunate to go into get into a fellowship program at UC Davis to get into MIS fellowship, or laparoscopic fellowship.
Awesome.
So what happened was, it was an accident.
The best kind.
The best kind of accident. They're like, hey, since you're here, Dr. Choi, would you be opposed to learning weight loss surgery? I said, absolutely not. I'm here for a year, and might as well just learn as much as I can. So that's where it started, accidentally.
That's awesome.
Yeah.
I love that.
Yeah.
And so tell me, I want to ask you the difference between, you mentioned bypass and the sleeve, because I get that question a lot.
Sure.
And then I want to share with the world what the sleeve is like. You can take us through that.
Sure.
Yes, if you don't mind. So what is the difference between bypass and sleeve, and why you do one versus the other?
So I stated before, so I love the gastric sleeve. It's the most and it's not just for me, it's the most popular surgery in the world. It has surpassed gastric bypass.
Wow.
What is gastric sleeve? Gastric sleeve is when you remove and cut 70 to 80% of your stomach, and it looks like a banana.
Yes.
Okay. And that portion of the stomach that you take out, we put it in the garbage can.
Okay.
You're like, all right, we don't need this. So the other surgery is called the gastric bypass.
Okay.
Where in the word bypass, you bypass the small intestines. Okay. And then you cut a little bit of the stomach, and you bypass the intestines, meaning that all the calories just goes and bypasses all the nutrition where the small intestines used to be, and then you don't take any calories. You don't absorb anything. However, with a gastric bypass, you do have blood dyscrasias, meaning that you have a lower H&H. You have to be on vitamins for the rest of your life. Whereas I tell my patients with a gastric sleeve, it's like just taking a 5-gallon tank and making it a 2-gallon tank.
Right.
And everything, I-95 runs the same way.
Yes.
But with the bypass, I-95 doesn't run the same way.
Right.
And that's where you have a little bit more problems, and you have to take vitamins for the rest of your life.
Right. And I follow many influencers who have done the bypass.
Yes.
And I agree with you, because I hear stories of, malabsorption,
yes,
needing to do constant blood work.
Yes.
It's not the same.
It's not.
And do you find that the sleeve keeps you normal? Because that's what I found.
Yes. I think that I like the sleeve, and if I had anybody in my family, because all you're doing is reducing the amount of foods that you can eat. If you can understand that discipline. So instead of eating a whole, Whopper or Big Mac or whole steak, you can have half of it and enjoy.
Right.
And if you can enjoy that and re-educate yourself that that's only the amount of food that you can eat, then it's a great procedure.
Yeah.
And then you'll feel full faster. And everything, and you're not hurting yourself, and you're not cheating your body of any nutrients that you want.
Right. Yeah, I agree. And that's exactly how I saw it. Again, going back to, do I want to add something?
Sure.
Meaning injections forever.
Sure.
We'll go through the complications. There are complications there because it's a medicine.
Absolutely.
Or, like you said, just finding, because it's very hard to find satiation, especially if you're someone who's always hungry or has, problems with food. And I love how you phrase that. You're just lessening the tank. You're just making it, smaller. And for the first time, I feel full.
Yes.
I would love to show on the screen what the procedure is.
Sure.
Because I get asked a lot, what is it that happened?
Okay.
And then how you do it.
Okay.
I know you have a special methodology.
Sure. So I use something called the robot.
Okay.
It's called Da Vinci, and that's what you had.
Yes.
You had a Da Vinci robotic sleeve. So as you can see there, I need to, before I dock my robot, I have to make 4 little incisions on the body.
Right.
And then I put the robot together, and then I sit in my console.
Unbelievable.
Okay, like a little cockpit.
Yes.
And I sit there, and then I do my surgery. So as you can see in the first, I have to cut the whole entire stomach on the greater curvature side on the axis point.
Yes.
And then creating the pouch, then I use a stapler and I make it look like a banana.
Right.
So now you see under the repair section that it looks like a banana.
Right.
And then after that, that greater portion of the stomach, as I said, that's where that hormone ghrelin relies.
Right.
That portion right there. And that's where the magic happens. Once I remove that, then you don't feel that hunger or that initiation to go and look for food.
Yeah.
Okay?
Very important.
And then after that, the surgery is done. I like to do an endoscopy, which it doesn't show here.
Okay.
And I fill the stomach up with some air to make sure that there is no leaks or complications.
Oh, brilliant. Yes.
Yeah. And then after that, we close you. You stay in the hospital for a night. You go home, and now you're here.
Yeah. It was incredible. I didn't even stay overnight.
Yeah,
I
you
think
left
I
early.
left the same day.
Yeah, I called you, and you
Yes,
said,
I was
wanna go
feeling
home."
amazing.
Yeah, I wanted to go home, and I said, no problem.
Yeah. I mean, you were so thorough. I'm so thankful that I found you. I felt safe. I felt confident.
Good.
Yeah. And
That's only what I would want if someone was looking at me.
Yes. And I think, interesting, because I get asked all the time that question, because in the past they would cut you wide open.
Yes.
And that was, a huge surgery.
Absolutely.
And I explained incredibly that it was 4 tiny incisions.
Yes.
I have barely any scars. And easy. It was easy.
Good.
And I remember that. And I just thought to myself, and, there's, of course, a lot of pushback everywhere.
Sure.
Doesn't matter what you do, even if you take the shot or even if you diet or whatever. But getting surgery, there's a huge stigma.
Yes.
It's
a cheater's.
Yes.
It's an easy way out.
Which is so.
It's not true.
Not true.
Absolutely.
And, I explain, it took me a while, like you said, it took me a while to be comfortable saying that I had the surgery.
Right.
Because I'll be honest, you feel like a failure.
Yes.
And I don't know if you find that from other patients, but I, at the end, was like, what is wrong with me? Why can't I do this on my own?
Right.
But I think it was a bigger step to say, no,
Right.
I do need the help.
Absolutely. It wasn't your fault. It's not, there's so many factors genetically, your predisposition for that, your lifestyle. As I said, that's another thing. And the population group.
Yeah.
Everything, to be honest with you, everything is surrounded by food.
Everything.
Right?
You go for a drink or you go, let's have a cup of coffee. Let's go to a cafe.
Even you go to commercials.
Correct.
On TV, you're watching stuff with your kids or something like that. There's going to be like KFC, buffalo wings, or something that's going to be surrounded by food. Or when you watch football or soccer or anything,
Absolutely.
It's all surrounded by food.
Applebee's.
Chili's,
Chili's, yes.
Everything is just surrounded by food. But also, it's a stigma that I hear it from my patients. But then once they start losing the weight, they're like, listen, I'll take this stigma because how else would I lost it on
100%. I mean, I remember the process. In the beginning, it was hard. Maybe you can talk about it a little. The
Sure.
mental.
Yes.
You still want to eat, even though the
Yes.
ghrelin,
yes.
ghrelin is gone. It's very hard to make that switch originally.
Yes.
You can't physically, but you want to.
Yes.
And I find, and I've spoken to a lot of other women that have done bariatrics, and there's a mourning period.
Yes.
Almost like, well, I miss eating. I want to eat. I can't eat anymore.
Because that's where you were getting your pleasure from.
Right.
Because it would be a serotonin release that you're like, oh my God, thank God I've had this.
So true.
To have this food because everything is so hard in my life right now, and that's where the addiction phase goes. So yes, believe it or not,
absolutely.
Believe it or not, studies have shown that some people who don't have those mental propensities for that feeling actually become addicted to other things like smoking and
heard
drinking.
that. Yes. That's so true. They find another outlet.
Exactly.
Yes.
In order to get that feeling back, because they don't know what to do. As you said, they do feel lost. And so, but we also have a dietitian in my practice that is telehealth.
Amazing.
So shows that he or she doesn't have to go there. They can just sit on their phone and help them.
Right. Very convenient. Yes, I remember you did give me that information because, and I would like you to talk about it as well. Stalling.
Yes.
Please explain what happens, why that happens.
Great question, Daniela.
That is a huge freak out.
Yes.
Oh my gosh, I'm doing amazing. I'm losing the weight. I'm not hungry.
Yes.
Doing everything the same. And boom, I'm not losing weight anymore.
Okay. So the reason why people have stalls is that you can't be losing weight all the time. All right? Because if you kept on losing weight, guess what? The skin would fall down and you would have issues.
Right.
So when you don't see changes on your scale, you don't know subconsciously you're having changes in your clothing.
Yes.
So when I tell my patients, they're like, hey, Choi, I haven't lost 10 pounds and I've already lost 40. What's going on? Did I do something wrong? I say no, you did everything right. But it's just that you're losing inches. And so they're like, oh yeah, I've noticed that I've gone from an XL to a large.
Yes.
And then I said, just continue what you're doing. And also, I also explained to them, the body doesn't know that you're trying to lose weight.
Right. That's a good point. Right? Yes.
So they think that you're on a stranded island.
Oh gosh,
you have
so
no
true.
food.
Yes.
So guess what happens? The metabolism slows down, right? To conserve energy and to conserve eating, right? So the body's going to slow down. So what I tell them to do is I tell them to increase your proteins, increase your exercise, so you can mentally tell, because you can't physically speak to your brain, but if you change your ways and increase your exercise, your protein, then the body will understand that, we're trying to lose weight. Yes. And that's when you start losing weight.
2 questions for you.
Yeah.
Can you mess up the sleeve?
Yes.
Please tell me about that, because I've heard, carbonated beverages or trying to eat too much.
Yes.
Is there a truth in restretching, or tell me more about that?
So by the guidelines, they don't recommend you eating and drinking at the same time.
Yes, and I physically know that.
Yes. Because they feel that sometimes the water will push the food down and then obviously expand the pouch or expand the sleeve. Now, the second question about carbonated stuff, I don't know, meaning because my former professor didn't have gastric sleeve, but had a band.
Okay.
But he drank Diet Coke like a fiend.
Right.
So I'm not too big. I'm not saying that it can't, but I say everything in moderation.
Yes.
I don't see any of my patients complaining about that. Now, the last question you said, can you hurt your sleeve, or what can hurt your sleeve? So it's very rare.
Okay.
People will go and eat and excuse themselves, go to the bathroom, vomit.
Oh no.
And then come back.
Okay.
But those are for more of an eating disorder.
Right. But that makes sense. Yes.
But that happens, and then just overeating. Lastly, just eating so much, but then you'll feel nauseous and vomit.
I was gonna say, yes.
You're gonna feel nauseous, so you'll stop before that. But there are people who don't adhere to that and listen to their body. Yeah,
I think it's called the foamies.
Yes, yeah. The foamies is when you eat so much food that the saliva that you.
Yes, I've had that before.
It starts coming up from above.
Yeah, it was a huge learning curve.
Yes.
And I think back to the point that it's not the easy way out. Like
No.
you still need to work out. You know, I still explain. So back to the question for me was, ooh, what'd you do? How'd you lose so much weight? I want to do that. And it took me a while, like I said, to say because of the stigma, but then I was really proud because it was a step that I needed to take to help with the food component.
Yes.
But there is working out. Otherwise, like you said, all the excess skin.
Yes.
And then there's more surgeries and, you know, then skin removal or, you know.
So what I tell you and my patients is that this is your tool.
A tool. I love that. A tool
to help you lose weight.
Yes.
Okay. And what you got to understand and patients got to understand is don't let anybody or anybody outside influence you and say, oh, it's the easy way out. It's not. Because I know what my patients have to go through. I make them or advise them to at least work out 4 to 5 times a week.
Yeah.
A minimum of 30 to 45 minutes if you can. If you could go an hour, perfect. But for those that follow the rules, they lose the weight.
Yes.
Okay? And it's not easy. You know, you could fall off the wagon just like this because you and I could go to, you know, El Camino and just start drinking tequila or, you know, and find other ways to bring those calories up.
Exactly.
Okay? But so you have to be relevant of what you wanted and understand what's happening. So, you know, I get it, but I also think that it's more jealousy. Because people are like, my God, she looks great. She looks better. And, you know, and they're like, and they wish that they had what you had.
Yeah. And I think there's a lot of truth in that because, you know, a lot of people make fun of the weight loss shot, for example.
Yes.
But a lot of people do find success.
Yes.
And I know that it controls PCOS.
Yes.
You know, I mean, I've done all of my research and deciding which, but again, you know, and I see a lot of your patients, I know how happy they feel at the end.
Yeah.
You know, there's a learning curve of re-eating.
Yes.
And being afraid, I felt, of wanting to eat more food because then you're scared. Oh no, like to your point, is it working? Why am I hungry again?
Yeah. Right.
But you can't sustain 500 calories for the rest of your life.
Right. But you brought up a really good point, which I don't think people understand also. Irregardless of what weight loss method that you like to choose, the main success, the main goal at the end is what you just said. PCOS resolves. 70 to 80% of hypertension gets resolved.
Yes.
70 to 80% of the sugar, type 2 diabetes, they're off their metformin. They're off their injections.
Yeah.
They don't need to take that. And people who have the sleep apnea machine, they actually throw it in the garbage because they're not apneic anymore.
Unbelievable.
Yeah.
I know obesity is an epidemic.
It's an epidemic.
That's where we are. It is an epidemic.
Yes.
And there is help. There's help. There's you.
Yeah.
That's incredible. I mean, again, I can't thank you enough. And I'm so thankful I found you.
Oh,
you know, I did the research and, you know, funny enough, I was looking into plastic surgery and I was looking, you know, what can I do? What can I do? And I'll be honest, I tried lipo before I met you. Some of my friends have tried that also. And they come to me, oh, what do you think about that? And I'll tell them the truth that happened to me. It doesn't change how you eat.
No.
It doesn't change your habits.
Correct.
You gain the weight back.
Believe it or not, it's a temporary fix. And then another thing, another curveball, do you know the fat that you take out? That fat, we dispose of it. You know, I don't do it myself.
Right.
But the fat that you will gain in the future you'll get it in different positions of the body.
Oh my gosh, I believe it. Yes. Correct. That is the truth.
So that's what they don't tell you about also. Just because they do liposuction, oh, I'll get it back here. No, it resides somewhere else. And you're like, oh my God.
Right.
Right? So they get freaked out about that. But yeah, it's what people don't understand is that if you get weight loss surgery and what you're going to have a good result, And then if you want to have any aesthetic component after, you're going to have a better result with it, because now you're going to see, because people who are 100 pounds are like, yeah, I'm going to go to get some liposuction, but they suck it out. But it's like there's no results.
Right. And it's only 10 or 11 pounds that's allowed in Florida.
Right. Yeah, exactly. And
which I learned.
Yeah, it's 1 liter to 2 liter max.
Right.
I'm not too sure. I'm not a plastic surgeon, but the thing is, there is a limitation on that. It's like, going to the Lake Okeechobee and sucking out some water. You're like, well, I sucked out 100 gallons.
Right.
Well, it's not going to do anything.
Right. Absolutely.
And you brought up a great point. Just because you suck it out doesn't mean that if you don't change this portion of it, what you eat, it's going to come back.
Absolutely. And I think, again, I know from personal experience, I've even done, I've been to therapy for binge eating, and, I've done it all. I really tried it all.
Yeah.
And it was the best decision. I wouldn't even say the hardest. I think I was so ready. I wanted to be a new person. I wanted to be myself. I mean, I have 2 young boys. My husband's very active. I wanted to keep up.
Yeah.
And I couldn't take it anymore. I really felt that I got to a point where I wanted to be different.
Right.
Funny story, how I decided, a friend of mine lost a lot of weight. And I reached out to her and I said, what did you do? While I was looking for you, ironically. And she said, I did the gastric sleeve. Boom. It's like, that's it. And then once I started telling my story, so many people have done it and found success, and they don't talk about it.
Yeah.
I was shocked. I had friends. Oh, my sister did that. Oh, my uncle just did that. Oh, I have done that. And there's so much success.
Yeah.
There really is.
There's a lot of celebrities that have done it and they haven't.
I believe you, and they don't talk about it. No. And they're very open about Ozempic and trizepatides. Like, why don't we talk about it?
I don't understand. Like, Mariah Carey had it.
Really?
Yeah.
I did not know that. Is that a fact?
Yeah.
Unbelievable.
Then,
good for her.
And then Ozzy Osbourne's daughter, Shannon, I believe, had it.
Wow.
Yeah.
There's She lost a lot of weight.
I
mean, she looks incredible. Chloe.
She looks great.
Yeah, she looks incredible.
Chloe looks great. But what I'm trying to say is, I don't think, is it possible? Yeah, but she lost it in such a short amount of time.
Right.
That the injections wouldn't have been that successful. But yeah, there's a lot of people who've had it and they don't say it.
Yeah. Or unbelievably, they do. And it's funny because eventually one of my goals is to start a group.
Yes.
For moms, for other women.
Absolutely.
That's really why I built this space. But to talk about that, to have more women be open and comfortable with weight loss surgery.
Yes.
I met another friend who told me, she's like, I did that too. Once I put my story out, I got tons of people coming back to me. Daniela, I was like that. Daniela, I've done that. Maybe not gastric sleeve, but tons of plastic surgery because I wasn't happy. I was overweight my whole life, sending me pictures. Incredible.
Yes.
But the support, even though, yes, there are nutritionists and yes, there are therapists and everyone is incredible in their own way, that real support, that I'm a real person, I did this, I needed this help, is lacking.
You're 100% correct. It's very, very difficult, because what happened is, I used to have support groups in my many years ago. But what happens is if you find that one person who's not happy, she spoils the whole barrel.
Yeah.
Okay. Well, you know what? Daniela lost 80 pounds. I only lost 30. But then when you go into them and you ask them why they weren't successful. Oh no, did you exercise so and so? No, I didn't do any of that. Okay, what was your diet? Did you decrease your carbs, or did you go see the dietitian? No, I didn't do any of that.
Right.
So it's very, very difficult to do that. Not saying that you can and cannot be successful at it, but it's very hard, because someone's always going to be jaded.
Yes.
And that's what's really, really, really difficult, to keep that person in check while trying to have a support.
Absolutely. And they say you are who you are with.
That's correct.
So that's a really good point that you make.
Yes. So then once you start doing that, and then once you have that negativity flowing, then it destroys the support group.
Right. But then on the other side, I see tons of your patients, 70 pounds, 80 pounds.
No, I'm very, as I said, I'm very blessed. My patients do well. But I also, as I said, I also check on them.
I was going to say that. You are the support. I mean, I think the next day, week 1, month 1.
6 months to a year. And then if not, then, I have my girls send out an email.
Right.
Hey, I haven't seen you. What's going on? So I kind of stay on top of that, so that, they give that. And I also, if they really need it and they ask me, I give my cell phone.
Yeah. I know. I have it. Right. You're incredible. We're good friends now.
That's what I'm saying. I give out my cell phone, and they're like, I was joking before, don't call me at 4 a.m.
Right.
But if you have a legitimate questions, text me and I'll text you right back.
Yeah.
And I try to give all entry points to communication. And then, and then some people are like, oh, I haven't been there for a year. And I said, okay, well, that's your fault a little bit, because you are not being responsible or compliant. So, so we're going to help you, but you have to have the communication that goes on.
Yes. So another question, at which point do people go in for a revision versus getting on weight loss shots?
So that's a great question, Daniela. So it's up to the consultation. Okay. So when they come in, we discuss what's happening, and then I do some diagnostic tests to see what's going on. If I can revise it or change it, yes, I'll do that. But then sometimes they want to only lose 10 to 15 pounds. So I usually give them a low dose, Ozempic, Trizipatide, Mounjaro, and then, there's a new drug called Rituximab, which is going to hit another receptor in the brain.
Oh, wow.
But it's not FDA approved, but I know people are using it. But it's probably on an individual basis of what's going on.
Fair.
And then, but if you notice that, for a fact, hey, Dr. Choi, I'm not going to be able to do it with the injection, then I'll give you the option of having a revision surgery.
Yeah, I think that's beautiful. I think that's, exactly that. Back to the point. Try it. And if you can't or don't want to, there are other ways.
Right.
And I'm a proponent for surgery. I know a lot of people are scared, but it's life-changing.
Yeah. But no, you're not the only person, because just recently in the last 2 months, I've done people who were on injections for 8 months, had no success at all. So, it really is individualized, as we're trying to say. And I try to give that option to my patients. Patients coming in to see me this coming Tuesday has the band for 10 years.
Oh, wow. Okay.
So she's thinking about a revision.
Yeah.
So those are the things that goes on. And then I'm going to give her all the options, and I'll tell her what the best option would be.
Right. And so tell me, the band is what in comparison?
So the band was something where it would be a balloon that would go on the upper part of the stomach.
Okay.
And it'd be connected to this little port, like a chemo port.
Okay.
Underneath the skin. People didn't like that, because once you started losing weight, you saw this big bullseye thing.
Oh, interesting.
And so that's what we do. You would come in every 6 to 8 weeks, Miss Daniela, and you get it filled, and it would tighten the entrance to your stomach.
So you have to continuously get it filled. Interesting. I didn't know that.
And then you hit your limit, because obviously you can't make it too tight. But there is a big group of people that have that in the Orthodox community up in Brooklyn.
How interesting.
Have the band.
Okay.
Have the band. And because they felt that it was to keep them more, they didn't change their body.
And that was the answer back then.
And that was the answer. But there is a big community in Brooklyn that has the band.
That's so interesting.
Yes.
I mean, I have grown up with other people who have tried staples in their ears.
Yes.
I mean, I've seen it all.
Acupuncture.
I have seen it all. I have heard of it all. I have, again, done extensive research. And unfortunately, it comes to what's wrong with me.
Right.
And I think that's really hard. I can't speak for men, but I find that for women, it really goes back to that. What is wrong with me? Why can't I lose the weight? Why? Because I was certain I'm going to jump right back on. I'm going to get on Weight Watchers. I lost 50 pounds when I was in college on Weight Watchers. I was a huge proponent. I worked for them. Huge proponent. I still am. I still love thinking of a lifestyle change and not a diet. I think they're phenomenal. However, I couldn't jump back on the wagon.
Right.
And yes, you can fall off a million times and you keep getting back on and get back on the bike, get back on the horse.
I think is what we discussed, is that you know that you were limited,
right?
Because you could only eat those food. You couldn't do anything. Maybe you have a cheat day.
Yeah.
I think that the sleeve gives you a more natural.
It does.
So you're not restricted to eating out of a 6x6 cardboard, tray that you microwave, and you go and you eat, you drink what you want, but in moderation.
Right.
The key is balance. As the premise that we're setting right now is that if you can do that, then you're fine.
And I agree. And I think, as someone who's been on a diet since the first grade, I was one of those.
Yeah.
What are you eating and why are you eating that? And are you sure? I was a closet eater, meaning I would sneak food. That doesn't go away.
No.
But with bariatric surgery, I no longer feel like I'm on a diet.
Right.
Because the hunger cues are back.
Sure.
I know when I'm hungry. I know when I'm full.
Sure.
And I can taste things. So I can have a bite of cake and not eat the whole cake.
Yes.
I can have a slice of pizza and not go back for 3.
Right.
And that alone is life-changing.
And also, you're not recording and checking off the box.
Right, that too.
Okay, so that's what I'm trying to keep telling you, the limitations. People don't like to be limited, right?
It backfires.
Exactly. Like if you go on a plane, they're like, hey, Miss Daniela, would you like first class? Of course, right? Course. Would you like champagne? Of course. Right. Would you like the caviar? Of course. But that's what I feel like there was a restriction. Not saying it works for some people. Yes. They can do that. They have more discipline.
Yes.
But it doesn't work for everybody. But also I think that when you curb and restrict someone, they don't like that.
Yeah.
They don't like that. They want to be able to do and say, hey, I'll go to Mexican today, or I'll go to Greek, but I'll go to this. But if you say, oh, here's the food that I eat and blah, 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 everything. And no one really likes that.
It's not sustainable. And talking about the pleasure of life.
Yes.
Because it's cultural.
Yes.
It's everything. Food is everything. You want to sit with your family and have a meal, the holidays.
Right.
It doesn't matter what holiday you celebrate. There's food. There's always food. And how good is the food and who's bringing what?
And then it'll be like if you went to Yom Kippur dinner and you brought a tray.
Right.
Or brought your Weight Watchers, you'd be like, what are you doing, Daniela?
Right, I know.
Why?
And then you're secluded.
You're secluded. Then you're like ostracized. Get out. Are you done? So don't ruin my meal because of whatchamacallit. But you're absolutely correct. Food is a staple in any culture, any religion.
Yeah.
And it's unfortunate, but some people don't have that mechanism to stop. And
I agree. And I think that's really important. And we've said it, but I think to really hone in on that, it really is internal. There is a mechanism, and some people don't have it.
Yep.
And it's hormonal or whatever it might be, mental, but it's real.
Yes.
And something that you and I have talked about, food noise.
Yes.
And I'd love for you to go into incredible. You brought us a little demonstration, but what is food noise to you? What have you heard? What is your take on that?
So basically what happens is, what do my patients tell me? They're like, you know what, Dr. Choi, I used to not, want or crave something, right? And, what I tell them sometimes is that it's okay to crave.
Okay.
I tell them
it can be scary. I've experienced it. Yeah.
So what I tell them to do is try not to have that craveness Monday through Friday. You're going to hear. But on Saturday, if you have the crave, have it.
I love that.
Okay. So then why? Because you're going. It's not going to go away.
Right.
I wish I was omniscient and I knew exactly what the cause of this is. But then, so sometimes other options that I've been looking into is like, get a microdosing or low dosing of Ozempic or something like that to see if that helps you.
Right.
But so what we will usually give is tirzepatide or something like that at a low dose and see if that helps.
Right. Can you tell us the difference?
Yeah. So the Ozempic right here is basically a semaglutide. It's for a GLP.
Okay. Which is what?
It is a receptor agonist, so you don't feel hunger.
Wow. Yeah.
Okay. And then the tirzepatide or Mounjaro does GLP and GIP. So it slows down the gut, slows down the hunger, and then it works twice as effective.
Right.
And then raturitide is going to be a GLP, GIP, and something else I don't remember offhand.
Wow.
And it's going to affect the brain, so it's going to do 3 different things.
Right.
And so far, the studies, although even though there's no FDA approval, but there are trials, has been very successful. So I think that in conjunction with bariatric surgery, of any bariatric surgery that you want, I think by taking the shot or by doing that, it's going to help you with that food noise. As you said, oh my God, I got to eat that, or I'm feeling a little bit more hunger. It's going to sedate that feeling.
Right. I think when people who don't understand food noise. And I hear it a lot because I think that's the biggest part of the weight loss shot is most women or men take it because of food noise.
Yes.
And if you don't know what that is, it's literally thinking about food
all the time.
All the time.
I know.
Almost all you think about. What's my next meal? What am I going to cook? Did I eat? Am I going to eat? What am I going to eat? When am I going to eat?
Yeah.
It's consuming.
Yes.
It's really... It takes up space in your head and energy.
I agree, and I try to tell them if you have the time and if you have the food noise, go to the gym.
Yeah.
Or go walk.
I agree.
Go do something to take your mind off of it.
Yeah.
Because that food noise is usually the maximum, I believe, is about 5 to 7 minutes. It's a long time.
It's a long time.
But
a lot can happen in 5 to 7 minutes.
Exactly. But have you noticed that? Have you noticed that, God, when you're at work sometimes and you're so busy, but you're really, really hungry, but you get involved, you get sidetracked?
Yes.
You forget about eating.
Yes.
Okay? So that's why I said it's only at a certain amount of time.
Right.
So that's why I said go to the gym, go take a walk, or preoccupy your mind. And honestly, you might forget it. You'll forget it. But obviously, it's going to come back.
Yes.
But at the time, it'll help you. So that's why I try to do that. And then I say, not cave in is not the worst word, but I just said on Saturday, just if you had the food noise, just have it.
Right. And so at what point do you find people are able to move past it, work through it, versus then getting more help?
Okay, so that's an individual thing.
Okay.
It's patient to patient case. Some people are really mentally strong.
Right.
Right? They can fight it.
Right.
I'm not saying that you're weak, but
no, absolutely.
There's always something that are like, oh God, I wish I could have that piece of cake. I've been so good, whatever, and stuff like that. And other people are like, I gotta have the cake.
Yes.
I don't care.
Happen.
I can't do whatever, Dr. Choi, you can put me on, 100 milligrams of Ozempic. It's not gonna happen. So it's gonna be a case-to-case, individual consultation on what's gonna happen. But you know what? I think that if you just do it in moderation, you'll be fine.
Yeah.
Now, if you're telling me you have a whole pie,
right?
Then I'm like, there's something wrong with that.
Right.
Okay?
That makes sense.
So we're gonna have to, either take you to the dietitian, or you're gonna have to see a psychologist, or maybe there's something else burning inside you that you need to do that. But individual is probably the best way.
Yeah.
And I know some people don't like it, but I like to. When women ask me, hey, I need something to help me with that food noise, I said, we'll do a low dose.
I love that.
See what that happens.
I honestly didn't know that you offered it.
Oh yeah. I just started because what happened was that there are some complications.
Please tell us.
Okay. So there's been so what happens is that there's Ozempic phase.
Okay. Yes.
Where you lose the fat and the muscle, so then everything comes down, right?
Right.
There's Ozempic babies.
Tell me.
Because the metabolism slows down in your intestines. And when you take your birth control pills, the efficacy goes down.
Interesting. I didn't know that.
So women who are on birth control are getting pregnant.
Oh my goodness. I wonder how many people know that.
Right? Then you have stomach issues where it's called gastroparesis, where it stops functioning. All right. And then when you're on any of these injections, you have to quit them for 1 week prior to surgery because the stomach can reflux into your lungs and cause a pneumonia.
Wow.
An aspiration pneumonia.
Got it.
And then people get problems down there with their poo-poo. You know, they get constipated, and then leads to other problems like perforations and stuff like that.
Wow. Okay.
Right?
So what would you say is the cost benefit?
So
with all of those side effects, what still brings you to say, you know what, this is okay for you?
Okay. So since I'm a bariatric surgeon, I'd rather for you to have access to a weight loss drug versus not, because obesity will kill you.
Yes.
Because it will lead to cardiovascular events or diabetic events, which will lead to chronic kidney disease and failure. Okay.
So important, yeah.
But the thing is also is that don't get taken by, get the right information, and also understand now these injections are the same price as getting weight loss surgery.
Wow.
So now you have to weigh, would you rather just be done and one and done?
Yep.
Or would you rather just keep on paying month to month forever for the rest of your life?
Right.
Eventually, I know there's going to be some drug, that miracle drug that's going to take care of everything. You know, your face, your liposuction, change your body, all that stuff. But, you know, as a person of weight loss, bariatric surgeon, I really think that you need to have access no matter what your means is, because the benefits outweigh the costs. I
agree. Thank you for that, because you know, it's something that I always talk about. It's very controversial. Any kind of medication, you know, mental health medication,
Absolutely.
You know, weight loss medication. It's a tool.
Yes.
I'm thankful that it's there.
Yes.
You know, yes, do I go to therapy? 100%. There was a while that I needed both. I was able to tricate off of a lot of the pills that I was taking, you know, holistic approaches, but it takes a lot of time and a lot of willpower and a lot of energy and a lot of focus. And you still need the help. And I think that's okay. I really, you know, offer that to everyone. It's okay to get help.
Yes.
And I think that's part of the stigma that, you know, you have to do it on your own. You weren't strong enough. You were weak. You know, stop eating, close your mouth.
Yes.
Like, it doesn't work that way.
No. You have to, that's why I say you have to be educated.
Absolutely.
Right? And I'd like to, this is the best. For me, this is for doing weight loss surgery, it's the best. I love helping people. I don't mind.
Absolutely.
I don't mind that they call me. I don't mind doing that. And I try to, even when they want extra, like they want to get plastic surgery, I usually try to give them the right route. Like I try to treat them and say, oh, I know this person, I don't know this person. You're going to have to do your due diligence. But if you're comfortable with it, I'm fine. I'm kosher with that. But if you're not, then I'll give you other options. And then you, as the individual, have to make that decision.
Yeah, it's
like
beautiful.
I can bring you to the lake, a horse to the lake, but I can't make it drink.
Absolutely.
Right? So, but if they understand what's going on, but I understand what's going on a digression. I understand what's going on in the world today. Not everyone can afford weight loss surgery. So that's why I keep on saying that if you want weight loss injections, I do offer it in my thing, in my office, and I will help you. And then if it doesn't work out, then we can go to the next step.
Which is phenomenal. I think just knowing that option is comforting on its own.
Yes.
And that they can reach you.
Yes.
And that you know, revision or whatever it is, there are more steps. There are more steps. You haven't hit a wall. You're not alone.
Yes.
I mean, you literally changed my life. You're changing lives.
Thank you so much.
And I know it's clear how much you care. And it can be very lonely.
Yes.
And you really offer that support.
Yes.
And I do think that it's important for more people to feel comfortable and to speak about it and own it, I guess, is something that I learned for myself. This is what I needed to do. This is what I did. Now I feel incredible. Now I'm trying to reshape my body.
Absolutely.
But that was my tool. That's what worked for me.
Yes.
And would never take it back. I would never change it. It was the best thing that I did, and I thank you deeply from the bottom of my heart.
I appreciate it. Thank you so much for your kind words.
Absolutely. So please tell the audience where they can find you,
Sure.
all your information, because if they need you, they should definitely come.
Yeah, so I have multiple offices. I forgot to say before that I've just opened up an office in Miami. It's called New Body Bariatric Center. And also I'm in Fort Lauderdale at 4390 North Federal Highway in Suite 206. And my office number is 305-821-3795. Give us a call. I will help you as much as I can, and you can be our next Danielle.
Absolutely. And social media, you have social media.
Dr. Michael Choi, Instagram and Facebook.
They should definitely follow you. You're incredible. Thank you, Dr. Choi.
Thank you very much.
And please like, subscribe, hit that bell for Seasons. Continue on this journey with us. We have a lot of great information, a lot of support. There are all these seasons of our lives, all the ups and downs, but we're here together. And thank you again for joining us.
Thank you so much, Ms. Daniela.
I'm so happy to have you.
Thank you.
Thank you, everyone.